On top of my general urology practice, where I see a variety of patients with urologic conditions, my specialty is in infertility and men's health. So men who are suffering from problems with conceiving, as well as erectile dysfunction or low testosterone. So there's a variety of causes and contributors to infertility. There's a number of things we can do to help the patient. Some of them involve their overall health. Some of them involve helping them to achieve a pregnancy, which is obviously their main goal. And some of them involve making sure that the offspring is going to be healthy as well. In terms of surgical procedures, I specialize in microsurgery. So I do varicocele repairs, both for fertility reasons as well as for pain reasons. And I do microsurgical sperm extractions. I also perform vasectomies very regularly, as well as vasectomy reversals for those couples where the situation has changed. These are topics that are personal, whether that's infertility or whether that's erectile dysfunction. And some people certainly come with some self-consciousness about this or even shame. And so I think first step is just being an open, good listener and reminding patients that they're not alone. These are common conditions, as well as letting them know there's things we can do. So all these things have options and ways we can help.